Yeah, Evelyn, good to go.
Okay. A very good evening to you all. I'm sure all of us attending today's session here are budding pharmacists and are in the process of making important choices in choosing whether to take the road to the left or right in order to shape a successful career for ourselves. I take this opportunity to welcome you all to today's webinar organized by the Indian Pharmaceutical Association Student Forum. Today's webinar will highlight the route to being a clinical pharmacist in UAE. Without further ado, I would like to introduce our eminent speaker for the day, Mohamed Hisham Bashir. Sir is a clinical pharmacist in Cleveland Clinic, Abu Dhabi, UAE, and a clinical assistant professor of medicine, Cleveland Clinic, Lerner College of Medicine, Case Western Reserve University, Cleveland, Ohio, USA. He works in the emergency department, antimicrobial stewardship, Heart and Vascular Institute on a rotational basis. He earned his Bachelor of Pharmacy from Amrita School of Pharmacy, Kochi, India, and Doctor of Pharmacy from KMCH College of Pharmacy, Coimbatore, India. Sir has American Board Pharmacy certifications in critical care and infectious diseases. He has more than 20 publications, including a book on general management of poisoning, and has presented more than 25 research papers nationally and internationally. He was awarded Best Preceptor for CCAD Pharmacy Internship Program in 2018. I welcome you, sir, and the floor is yours.
Thank you so much, first of all, for the organizers and the association for inviting me for this webinar. And it's an honor to speak amongst the budding pharmacists who are enlightened or like are in the progress in between their career, where they would like to progress it towards taking it to the next path. So this webinar is totally focused on the clinical pharmacist or the pharmacy career in the United Arab Emirates, the country which I'm working at presently. And it would be covering a few of the details in regards to how to get into the job, and what is the process, and how does a clinical pharmacist career can be built in this country. So I would not be talking about the other pharmacy roles in the country. Like, say, for example, I would not be covering the industrial pharmacy roles or medical representative roles or pharmacovigilance or any other apart from the pharmacist roles in the community pharmacy or in the hospital pharmacy settings. I do not have any disclosures. And as we've discussed, the learning objectives for today's presentation is to discuss different clinical pharmacist roles in the United Arab Emirates, and to discuss the licensing process to get into the country. So just quickly going through an update. So I have few slides, and just very few slides, and I would like to keep this into a more interactive kind of session, and just 3 or 4 slides. Apart from that, it's more of interaction, where I know many of you have a lot of questions and a lot of doubts or something. Some of them will have things to be clarified or needs more of a decision where you could make better when you get it more clarified. So this would be kind of a more of interactive session, where you can even interrupt me in between to ask me questions or clarify doubts in between, or it can be even towards the end of the discussion, where we can have all these go together in one go. So just before we start, this is one of the things which I would like to highlight is this is an updated document which has been released, which is called the Unified Professional Qualification Requirement. I'll just show you how this looks from. So you can see this is the document. It is Unified Healthcare Professional Qualification Requirement. In the country, There are different Ministry of Health in different emirates, like you call states in India, it's emirates in United Arab Emirates. So there are different emirates, like you have Sharjah, Dubai, Abu Dhabi, and rest of the northern emirates. So it depends, all these have unified, and they've put the professional qualification requirement, the document which is in front of you. And this is for all the profession, including pharmacy. So this is the one which has been followed for who qualifies for the exam, and what are the requirements to appear for the exam. So this is quite an elaborate document. This has been updated. This is the third version, which got released, I think, the beginning of this month or last month end. And you find all the requirements in terms of medical profession. And you'll find specifically pharmacy in page 102, which is this screenshot. So we'll be dealing with more details of this updated document, and we'll be discussing how is it like to be working here in the country, and what are the different roles of clinical pharmacist, and even clinical pharmacists in the community pharmacy as well. What things you need to know, things you don't, things you need to clarify, and which would give you a better idea of how to choose to come to the country, if you totally required to come here, or like you have changed mind and you're planning to stay somewhere else. So this document, you can see it's been classified as specialist pharmacist, clinical pharmacist, and pharmacy technician requirements. So most importantly, what is required is, first, before coming to any country, specifically the United Arab Emirates, the minimum qualification needs to be there, with along with minimum experience is a need. So this would make you eligible to appear for the licensing exam. So that is what is in different Emirates, it's different. So if it's for Dubai, it's called DHA, Dubai Health Authority. If it's for Abu Dhabi, it's called Department of Health, DOH, previously known as Health Authority of Abu Dhabi, which was HAD. And depends upon which emirate, and for the northern Emirates, it's Ministry of Health. So the qualification and what experience is needed is almost same for almost all the Emirates. So you can see it's been classified into 4 here. This is, you can see in the bottom, it excludes anyone with a pharmaceutical company or a sales representative experience. So it's not expected as a experience for practicing in this any of these pharmacist roles. So as you go on, let's start from the bottom, we'll go up on, and you can see pharmacy technicians, they need a diploma in pharmacy with which is a minimum 2-year course duration. And after the qualification, they need 2 years of post qualification experience, working experience in the country they're practicing. If it's for pharmacist licensing exam, you can see they need either a Bachelor of Pharmacy degree or a Doctor of Pharmacy degree. After the degree, that is, degree includes the internship. Okay, so after the internship, they need experiences of 2 years post qualification. This is exclude the experience here, which is 2 years, is excluding the internship. And it starts from the time you licensed in the country you're practicing. From there onwards, from say for example, after you qualify, you completed your internship, you got your license in the country in India, if you're practicing in India. And after the license, it's 2 years calculated from there. So majority of time it is you can so it is 2 years experience post qualification, excluding internship if it's a PharmD program. Moving on, it is next we come on to the clinical pharmacist licensing exam. This includes, like, if you see, there are different categories, and this is specifically for categories from all over the world. Whoever wants to apply, these are the ones which matters for them. And whichever, if you fall in any of these categories, you will be qualifying for the clinical pharmacist exam. You can see here, the first category over here is VPharm and the clinical pharmacy residency program, like a PGY1 residency program, which is accredited by ASHP, is the requirement for being a clinical pharmacist licensing exam eligibility. And there is no experience required for this. Okay, no experience sense, because the residency program, which is minimum 2 years, itself, it gives them experience. So that is why it's mentioned here, no experience was the first one here. We look at the second one, you can see a PharmD program of 6-year duration with a 2-year experience post qualification. That is a minimum with a minimum of 6 months in in a hospital setting. So this includes, say, if, for example, if it's someone's working in a community pharmacy in India, still they can qualify with if they have at least minimum of 6 months in the hospital setting. Moving on, you have a bachelor's of pharmacy and 2 years postgraduate qualification, which is leading to a PharmD or doctorate pharmacy or master's program. So this qualifies for people who have completed bachelor's of pharmacy and post-baccalaureate PharmD or master's in clinical pharmacy from India or pharmacy practice. And for them also, the criteria is same for the experience. It's 2 years post qualification and with a minimum of 6 months in the hospital settings. So this is specifically for a clinical pharmacist licensing exam. If someone's looking for a specialized pharmacist exam, this is quite tricky. So this is for people, I would say, you can see only two categories here. In this Bachelor of Pharmacy PharmD program and 1 year post graduate qualification in any of the specialties listed in the next page. So I'll come to the specialties. Before that, let me complete this, and when we come to the specialty, we will explain more about that. So you can see here, it is a Bachelor of Pharmacy or PharmD degree plus 1 year of postgraduate exam. I'm sorry. One year of postgraduate qualification in the specialty. Say, for example, someone's has a master's degree or any PG program in toxicology or critical care or any of the specialties available, they would qualify for this. And in addition to that, they will need 2 years of experience post qualification in the field. So that is along with the qualification, 1 year of graduation, post-graduation degree must be there in the specialty, plus they should have 2 more years of experience in the field, in the clinical specialty they're practicing. Next, in the same category of specialist pharmacist, there is a Doctor of Pharmacy or Bachelor of Pharmacy and American board certification in any of the specialties which is mentioned in the next page. So for these people, you don't need any experience after these qualifications, because as such, after Doctor of Pharmacy, to get American board certification, you need minimum of 4 years of experience in the specific specialty. So indirectly, this person might have already worked, already completed PharmD and worked for 4 years in the specialty to have taken the board certification exam. So that this person will also qualify to be a specialized pharmacist. So moving on, so I would come to this specialty licensing part. These are the different specialties which, as mentioned previously, has been documented or listed here. You can see the different specialty includes compounding pharmacy, oncology pharmacy, cardiology, critical care, geriatric, infectious disease, nuclear medicine, nutrition, pediatric pharmacotherapist, psychiatry, medication safety, drug information, ambulatory care, clinical pharmacology, or clinical toxicology. So if you see someone needs to be specialized, if you look at this document, someone has to have 1 year of postgraduate qualification in any of those specialties, plus 2 years post qualification to be a specialized pharmacist, or an American board certified pharmacist who would have any of those specialties listed here. These people, to have an American board certified pharmacy certification, they will need minimum 4 years to appear for the exam. So indirectly, they've been working on this specialty for 4 years, and getting a qualification, getting a certification in American pharmacy board of pharmacies makes it more easier for them to apply for specialized pharmacist roles. So coming on to what are the different in the country, what are the different pharmacist roles available? Most of them which are listed here is applicable for the country. So if you look at clinical pharmacists, most of them, if they work in the country in a multi-specialty hospital, they would be practicing in either of these or multiple of these roles as well. So even if you have any of these certifications, it will make it more easier for you to apply for the post and again to get the licensing exam cleared. If you can see this, uh, so these are the different listed out. Most commonly ones which is like the clinical pharmacist here are generalized, and if it's more specialized clinical pharmacist, that's mainly in critical care, infectious disease, oncology. Here we compound, and we do sterile compounding and preparation as well. So most of them would have that certification as well, and very few of them are qualified in here in the country in pediatrics, in psychiatry. And again, medication safety is also there in an aspect, and most of them would even prefer ambulatory care specialty, where if they're practicing in the community settings. So ambulatory care specialty is if someone's worked 4 years in ambulatory care and they've got the American board certification in ambulatory care. So that's how it makes them more qualified for applying for these roles. So just going through quickly briefing, if you're a pharmacy technician, it's diploma in pharmacy with a 2-year program which is needed, plus 2 years experience. If it's a pharmacist licensing exam you're applying, you need a bachelor of pharmacy or a doctor of pharmacy. And again, that would make you eligible for 2 years, after 2 years of qualification, excluding the internship in the PharmD program. And post 2 years after the internship, after the licensing in India or any country you're practicing, you will be eligible for applying for pharmacist license in United Arab Emirates. If it's clinical pharmacist, it is Bachelor of Pharmacy, and 2 years PharmD post-baccalaureate, or a master's in pharmacy practice with 2 years of working experience, excluding the internship. And of that, minimum of 6 months should be in the hospital setting. This makes them eligible. And if it's directly a PharmD program, 6 years PharmD program, it makes them directly qualify for getting 2 years of experience post PharmD, and will be eligible for this. If it's specialized pharmacist, as we've already gone through, it would be either of these degrees, plus they need to have an American board certification or a specialized qualification degree. If so, if American board certification does not need any experience, so if it's the other postgraduate qualification, it will need, after the graduation, we need 2 more years in the specialty. So again, this is something which is relatively very new, that is in the past 1 month or so this has been released. So there will be a lot of clarifications and a lot of questions and things which would rise up after this has come up. So people will be starting to apply here onwards, and as it goes on, a better clarity would be there as we progress, because things could be same, things could be modified. And again, the criteria would be looked into more closely when people start applying, and when more and more people start applying for the same. So this would be my last slide, and I would be discussing this in detail. Plus, we would keep a lot of interaction, so that it would make it more useful for whoever is planning to apply for the licensing in the country. So quickly taking you through the process of pharmacist licensing exam. How it works is, you submit the documents for an third party or independent check of the person. So the documents you submit are your valid passport, you submit all your degree certificates, mark lists, you submit your good standing certificate from the pharmacy council which you are currently practicing. Then you submit your the required experience letters from the places you worked. These should be attested, and it would be uploaded on the system. When you upload on the system, it undergoes a process called data flow, which is a third party verifying all these documents, whether it is fake or is original, whether these experiences were true, if it was really done properly, and if all these documents, name, the person, everything is right and matching the passport. The verification process would be over there. And how it's usually done is, there are a lot of centers in the many countries who would help in processing for these licensing exams, and they would also help you. Some of the centers even coach you for taking the exams, and they get you the exam dates, and you will be available to take the exam. So once all these documents, it needs a lot of attestation, things like that. And once all these attestation, everything is done, all these documents are uploaded into the server, which has data flow process would undergo after that. And once the data flow process is up verified, and your all your documents you submitted are original and it is verified, they would help you schedule the exam for the coming months. So how does the exam work is, I would go through it in a different as we come on to it. So scheduling the exam is also done through coaching centers, and there is multiple steps in which you schedule the exam and where you take the exam. So before you schedule the exam, you need to be ready to prepare for the exam. So mostly the question, so the exams may differ from this kind of specialty or kind of post you're applying for. And again, if it's say for example, if it's based on the emirates you're applying to work, the exam also differs. So for if you're taking clinical pharmacist or the specialized pharmacy exam, there would be exam is mostly multiple choice questions, along with oral examination will also be there, like it would be a viva. That is for clinical pharmacist and specialized pharmacist licensing exam. If it's only pharmacist and pharmacy technician, it's only multiple choice questions. And most of them are like, where you can take the exam is, most of them you can find centers all over the world, and it is conducted by a company called Prometric. They have centers all over India, specifically because this is more focused for students from India. So you have multiple centers in India where they conduct the exam. Again, if you come to UAE itself, there are also multiple centers, and scheduling is done on the system. If you apply through a coaching center, they are the ones who does the scheduling for the exam. What are the resources you need to prepare for the exam? If you have a very good coaching center in near you or in the region, you just have to go through them and they will help you with all the process, including the documents required, attestations, data flow process, getting you scheduling the exam, and even coaching you to prepare for the exam. So it includes reading out books, reading or practicing a lot of sample questions. These would help for preparing for the exams. What resources you need is depends upon where you're planning to take the exam, but most commonly the books which would be needed for preparing for the exam is basically Lippincott Pharmacology and Dipiro Handbook. These are the books which are very useful for covering the pharmacology part of it. Apart from that, there would be questions in drug calculations, dosing calculations and all, and most of them would be available in a drug calculation book called ANSILS. So this is one of the book which helps you for the calculation, drip calculation, the rate calculation, and multiple other compounding calculations and questions like that would come from ANSILS. And apart from that, a little bit of biopharmaceutical questions should also be there, which could again, there are multiple books, but specifically if you say they say they recommend Remington, but instead of Remington, when you could go, the number of questions or the percentage of questions from biopharmaceutics is going to be very less. So it would be like you could even refer to any of the books which you read for biopharmaceuticals. So this is kind of even pharmacology is the core, and pharmacotherapy is also a core of the most of the questions. You have a good percentage of questions from the drug calculation part of it, and some very a few very limited questions from the biopharmaceutical part, like what kind of, from mostly questions are from the dosage form or type of dosage form, and what are the different kind of dosage forms, and like differentiating between the dosage forms and things like that. So this is how the core exam is. So if you go to a coaching center, they will be having notes, or they would be, even if you want to prepare it by yourself, you can prepare it by books, get these ebooks or learn from these books if you already have, and that would help you prepare for the exam. And you get a lot of multiple choice questions which are available from the coaching centers, and they also help you to quickly prepare for the exam as well. So this is the whole process of how to prepare for the exam, what to prepare from, and kind of questions which could come for the multiple choice is related to all these. It would be available in all these books, and most of them would be if you prepare well for the exam, it would be very easy. And like, it won't be like if you don't prepare and go and take the exam you can pass, but if you prepare well from any of these documents, it will help you for passing. And the exam, the passing score, it's most of the time it's percentile, and they won't reveal the score if you passed, or if what was the score you got on passing, what is the percentage you got. You will only find pass or a fail. So there is no much details about how much is the percentage for passing, or like what is your passing score you got, or things like that. It's mostly percentile. You only get to know you passed or failed. Again, all these questions are computerized, and again, multiple choice options. Majority of the time it's easy questions, straightforward, and it is if you prepare well for the exam, you've practiced a lot of sample questions, it's quite easy to get through the exam. And once the licensing, the multiple choice exam is done, if you are going up, if you've applied for clinical pharmacy or specialized pharmacy exams, in depends upon the region. If it's Abu Dhabi, they will have a viva, that is oral exam will also be there, followed by, if you pass the written exam. And again, if for Ministry of Health in the Northern Emirates, they also have for clinical pharmacy exam, they also have the oral exam. So what the syllabus for the oral exam is open, so there is no specific syllabus that you have to learn specifically this topic or this section. It could be case scenarios which could be coming in, and they go in depth about the case. And it could be research statistics, asking you what kind of statistics you will apply, what kind of research plan or like methodology you want to do in this kind of scenario, things like that. The syllabus, there is no syllabus for the oral or viva examination. It's kind of open, and it completely depends upon the interest of the examiners, because there will be multiple examiners available for the oral exam. And that would be about the resources and how do you prepare for the exam. So mainly the books, as I mentioned, is Dipro handbook, Lippincott pharmacology, maybe even Tripadi would be useful for to an extent as well. It's basically pharmacology. They want to know the basic classification, and the Dipro handbook would be helping you more of pharmacotherapy related questions, which would help you more of application based questions. For calculation, it's Ansell's calculation, and for biopharmaceuticals, you can just prepare from any book which would help you more in depth of dosage forms and the difference between dosage forms. As I've mentioned, where you take the exam, it's a prometric centers are the people who schedule the exam, and they have multiple exam centers around the globe, and there are multiple centers all over India specifically. You can take the exam from there, and the some of them you'll get the results right away on that day. Some of them they will respond to you in emails after a couple of weeks or a month's time. It depends upon which exam. And after you pass the exam, what comes to you is the eligibility letter for applying, that you have a clinical pharmacist or a pharmacist eligibility letter, and you are eligible to find a job in the country. So with this letter you will be able to apply for jobs in the country, and based on the company's requirement or the hospital requirement, or wherever you are applying for the job, based on the requirement they hire you. And I would say it's not quite easy to get a job as anywhere in this world. And getting a job is as difficult or as equal to what is how difficult it is in any country. So people are graduating from the same country, people are coming from multiple countries to work in this country, so there are multiple reasons. So it's not getting a so if you clear the exam, it does not mean that you can't find a job, but based on what the hospital or the company requires, if you completely qualify for that requirement, and if you have the knowledge and skill to apply or show during an interview, or they think you are qualified enough, then definitely your chances of hiring hiring you as a person for the exact specialty or the requirement will be higher, and your chances are more when compared to other candidates. So this includes it's just showcasing your knowledge, your skills during the interview process. And again, you need to have that required experience in those specialties, or like if you're applying for specialties, or the experience you will help you answer more questions during interviews, and they will feel more comfortable taking you as a candidate. And it's, I would say, applying here, it's totally depends upon the individual. And it is not as easy as you think, and it's not as difficult as you think. So it's a strike between how good you are when compared to the rest of the people who applied for the job. And how you can make yourself better is by acquiring the best experience from the place you've already worked before, acquiring the knowledge, the skills, doing a lot of research, publications, building your CV, building your career even before you apply for the exam. And when you apply for the exam, it makes it even more easier for you to get through a job as well. So applying exam, viva, all depends upon how you prepared for all those things. And getting a job is another major task, which would be because as I've told you, the competition is very high wherever you go in the so even if you, the same thing, to get a job in India or anywhere in the world, the competition is very high. You need to stand out from the other candidates who've applied for the same post or same job. And how to stand out depends upon how much knowledge you've acquired. And so if again, if you qualify for that, you definitely would be eligible to get a job as well. And this would make things more a lot easier for you if you're applying in the country as well. So remember, these are few things regarding the exam. Licensing, after the licensing, if you may think it's easy to get a job, it's quite difficult. And the difficulty could be eased to a bit if you have the knowledge and the skill which could put you in the right positions. Vacancies may you may come across vacancies. There may be there may not be vacancies, there may be a struggle in the beginning. But remember, always getting the first job in any country or is very important. After you get the first job, it's quite easy to build experience and switch jobs or relocate, because the first job is an opening for you to come to the country, and that will open you a lot of it will throw a lot of light for your career as well in progressing in the country. And it is, again, if you like the job, you stay in the job. If not, you could even switch or swap jobs within the country, the same license, and the process is also possible. It's the initial thing is most important, is getting the first job would be difficult, but once that's you're through it, it would be a lot easier for you to get the job after that. And I think that would sum up my part of the presentation. And I would actually like if you guys could ask questions, clarify all your questions or doubts you have, it will be more useful and interactive rather than just a passive discussion like this. Let's keep it more active with more interactive discussions. Again, there is no other easy way out of the process which I've told you. And again, if you, a lot of questions which I get is like, can we do trainee pharmacy positions and then in UAE and then do for licensing? Better than that would be opting for getting a job in India or wherever you're working, get those experience and then come here. Getting a trainee job in this country as a pharmacist, there is only trainee positions for pharmacists in the country, but that may not be one of the greatest experience. I would definitely not recommend that kind of experience. Better than that would be getting the required experience from the country, learning properly, acquiring the proper knowledge and skill, and then coming here. So there is no easy way out. So people think coming as a trainee pharmacist is an easy way to come to the country, but that is a more like that is a more struggle, I would say, from my point of view, that it is to get on and then move on with the profession. If you're thinking of a long-term career in the same field or the career after you complete the training period, it's quite difficult. So I would not definitely not recommend that. If you would like to come here or be here in this country through all these process, then better to get the qualifications from the country you are practicing before here, and then come here. That would be my best recommendation. And I think that's for it from my end, and I'm open for questions. If you have any things to be clarified also after this, you can email me or you can find me in LinkedIn in the same name. And I'm open for questions or any interactions if there is any.
I request the participants to kindly type in your questions into the chat box.
I think I've gotten a direct message from one of them. It says it's from Lakshmi. It says, "Is assistant professor job experience useful for PharmD?" So, if you're looking for any of these positions, uh, it does not mention the lecture or academician post experience is calculated as a pharmacist or clinical pharmacist in the if you're applying for any of these roles in the country. So assistant professor job experience would not help you qualify to apply for the clinical pharmacist or a pharmacist job in UAE for now. Someone's asked for exam locations. You have multiple centers all over India, so it does not matter. Any major city would have a center. It is basically the Prometric is the one who's authorized to take these conduct these exams in the country. And Prometric, they have multiple centers. They tie up with some of the computer centers, and they have their own system of conducting the exams. You just have to schedule when your data flow process or the verification process is over. They help you schedule the exams, and the exams would be like a window would open up where you could schedule, can choose the exam and exam date, and from there you can choose where you want to take the exam. And based on there will be a priority list when you send them an email, which places do you prefer your prometric exam to be. So that would be basically it could be a prometric exam. Say for example, if you're from Mumbai, you can put Mumbai, and second preference would be Delhi, or second preference you can put in Pune as well, things like that. Now they'll ask you first, second and third preferences. Based on that, whatever is available in the nearest based on the date you've applied for, you'll be able to get the exam schedule in the country you're practicing. Again, if you've come across and you have someone in UAE, you are already here in the country and you want to take the exam from here, that will also be possible by scheduling the exam in the country, because there are multiple exams centers in here as well. Yeah, so someone's asked for two questions. One is board certification. I'll come to that one. Before that, is Arabic a must to qualify? No, Arabic is not a mandatory requirement for the exam. Uh, Arabic is not needed, but knowing the language would help you interact more with patients here. But apart from that, Arabic is not a mandatory requirement. So this is, if you look at the link here, which has been posted by the host, this would help you apply for the Board of Pharmacy Specialty exam, uh, which is the one I was talking about, and it has multiple specialties. And if you go through the website, it will give you more details. If you go under the international candidate, that is something which is the minimum requirement for doing a board certification in specialty is you need 4 years of experience in the category you're applying for. So that is something which is quite an elaborate topic. I don't know, if you want to have a look at the website, it would be really good. And again, it is you have to go under the if you look at here, you'll find this is the page, and you'll find when the exams are scheduled, things like that. You'll have to go on the resources, how do you do, what documents you need, things like that. These are things I would say would be useful if you're doing it. You can prepare for this ahead of time. Again, this would be useful if you're really trying to work in wherever you're working now for 4 years, and then if you apply this as a knowledge, like improving your knowledge, it would be really good. So yeah, this would be something which I would definitely recommend. So you can see the different specialties available, which was already listed on that, already listed over there, was already, it's here in here as well. So these are the different specialties, and this is where you apply for, if you're applying for Board of Pharmacy specialties. Any other questions you have, or any other clarifications? First thing is, like, before you take a decision to come or move out of the country you're currently practicing, you really think what is that you're going to achieve or you want if you're going from outside the country. If that completely satisfies your goal, or that completely fulfills your goal, then only you should apply. Just for the sake of trying it out, or if you have a very good job already there, then it's not like you just leave the job and go somewhere else. If you're completely satisfied with your job, and there should be a goal in applying outside. So if that completely fulfills, then you can leave your current job and definitely apply here. If that goal does not fulfill, then always it's good to stay on the current job, and when you look for opportunities, you look for better opportunities inside the country. And if you feel you've qualified enough, you can do these exams, and then you could, if then you change your mind to come, then you can definitely come. That is one thing I would say. Just make your mind before you come here. You should not like it, like having minimal 2 years of experience, or like not complete knowledge or skill, or say for example, you just have the exact things which others have, and you are not a standout candidate. Then I would say it would be a struggle in the initial period to get the job here. So that would be one thing you need to keep in mind. So don't wait for those 2 years to complete. Wait until you get the better knowledge, if you still have the time to do that. And once you have that, then it's better to apply, and then you come here. Don't exactly come after 2 years, because job hunt may be very tedious, and you may not get that soon. As of like, if I'm talking about the 2 years which you have right after your PharmD, may not be worthwhile. The knowledge you may get may not be that much enough when you are trying to apply. So if you take like just my example, I waited for 4 years to get an opportunity to come here. I didn't apply right away after the my required 2 years of experience. I waited for the right opportunity. I had set goals of why I need to go outside the country and what is the requirement. And based on that, when the opportunity came, I applied, and I've got a job here. So it does not mean that after 2 years you apply. So you can apply for after 2 years, but you can even wait for a few years and then apply after that, which is what I opted for, just because the amount of knowledge and the skill I was acquiring from the place I worked before here was very good for me. And the practice I was doing there was really good enough for me to help me practice more in the region and make it even better in my country. And then once I've said the things, I've give opportunities for others to join, and then that's when I decided, okay, it's time for me to move on and then relocate, because like my goal was to work in to acquire more knowledge and work in a better healthcare, or something which is really one of the best in the world. And I was able to achieve that as well. So I think I have a few questions. We'll go one by one. What would be the average pay for a specialist pharmacist? So average pay depends upon the job you're doing, the multiple things are there around this. It's quite, I would be able to say a range. I won't be able to say specific numbers. And along with that range comes conditions. A star would come, because the star is what I'm going to start first with. So the star is depends upon the years of experience you've had before. Where are you applying? It depends I'm sorry. It depends upon where you're applying for the job. If it's a private hospital, government hospital, and if it's a community center, things like that. If it's a big multi-specialty hospital, so that also depends. Your qualification, what your if you have more experience here, you get even more better pay. Again, if you have just basic experience, the pay not may not be that great. And again, if you're specialized, you have a lot of research publication, you have the best knowledge, the best skill, and your communication is very good, you will be able to negotiate based on this, and you would be able to help them and get a better pay. So if you ask me what pay you get, I'm talking about in general, ranging from, I'm talking about for beginners who come from a different country, first time writing the exam, and then coming on fresher in UAE. Okay, so this is I'm not calculating about what experience you have before. I'm talking about who freshly apply for a job in UAE. So for them, the pay ranges from somewhere around 3,000 dirhams, that is AED, to up to 12,000 or maybe even 15,000, depending upon, this is in dirhams. So that is the currency here. This is for a fresher who applies here, depending upon where they apply. So the lowest would be a community pharmacy, which is not even like not a branch or something which is small, and the highest would be in a multi-specialty hospital, or say a very experienced person or things like that. When you begin in, it would be and it's governmental or multiple things. It includes even allowance, basic salary, and the package comes like that. So when you convert into Indian currency, it would be, say, 1 dirham is 21.5 rupees as of now. So you can get from 3,000 dirhams to 15,000 dirhams as a fresher when you come to this country, depending upon how you are and how qualified you are. So that would be one thing. This includes allowance. It's not only the basic package, and multiple other things or allowances follow. So again, depending upon the job, your allowance and all your package also matters a lot. Okay, so you can see the same question has been repeated here: specialist pharmacist, community pharmacy, pharmacy technician. So even technicians are there who get highly paid, say 10,000 12,000 dirhams, so with a diploma in pharmacy. But again, it depends upon the experience they have in the region. And again, a fresher would have even lesser than that as well, very. So that those are the average pay scales in the region for a fresher. As you have experience, you change roles, you change hospitals, you get more experience in the region, you will get even more pay when compared. And you should post COVID, you shouldn't be expecting that much of pay, because it's quite restrictive for new people now. And again, getting a job itself is a big deal now, and having and sustaining a job itself is a very big deal when post COVID now, because it's really hit all the professions in the region and around the world as well. So how many years of experience is required in CP positions in Dubai? So I've already cleared this. It's 2 years or of post qualification experience is required if you look at the PQR document which I've shared before. So 2 years post qualification, excluding any internship which you've been doing if you're a PharmD candidate. Does the pay scale is influenced by the visa we have? No, it does not. It's not at all biased by the visa you have. The visa you have makes it easier for you to get a job, in terms like the company will not be sponsoring you for the visa, and you can say you already have a visa. Someone who's say, for example, the husband is working here, wife is coming along, and wife can get a residential visa through the husband. So husband is the sponsor, and again, through that the company avoids any extra payments they have to do for the visa, and so that it makes it easier for them. And having that may not influence, but having that, I would say, uh, would equally qualify if you have the skill and you have the other requirements. So having that without the others will not help at all, and having this on top of the others would definitely help. And this is not the only factor they look into. So another question is, do you have do they have many pharmacy schools? Yeah, we do have a lot of pharmacy schools in the region for the expats and for the local Emiratis who come here. So yeah, so if you look at the pharmacy schools, you have one in Dubai, two in Ajman, one in Sharjah. Like you have quite a few, like seven, I would say, for seven, considering the size of the country and the requirement of the country. Seven is small, but still the graduates are quite good enough, and the experience they get here is very well. They get trained, they have internships in hospitals here, which increases their possibility to get a job here, and that makes it more difficult for people from outside to come and get a job here, because during their internship, post pharmacy graduation from UAE, they're getting more trained and they are more used to the system in the country. So that makes it a lot easier for them and difficult for the people who are come from outside. But that is not a hurdle. If you are qualified enough, you have the talent, you have the knowledge, skill, you will shine anywhere you go in the world. How to place in Aster DM? So again, the qualified requirements, everything is same. It does not change upon the hospital. You, any of you qualify for these, with you have a license, you, whenever there's a vacancy, definitely it would come up. They have hospitals, they have community pharmacies, and they keep posting their requirements each time whenever there are vacancies available. Again, I would say, depending upon the when, even when you come to the region, when you apply and come to the region, I would say December, Jan would be a good time, because that's when people try to move jobs in the country or relocate. Say someone who's already working in one hospital may plan to switch to another hospital. It will be around the first quarter of the year. So possibilities of getting a job, the right time to come apply for the job and come here would be around the first quarter of the year. That's when usually people keep changing the jobs. So I would say that if you're planning to come, that would be give you a best possibility. It does not mean that that is the only right time. Other year round also you'll be able to get, but that chances are high, just because internally people keep switching or swapping around that time. And I would say summer vacation would be the not a great time to come here, because usually people don't leave jobs here and they go on vacation, school holidays, vacation, and all. They don't usually prefer to swap jobs at that time. So trend is, if you're coming first quarter, if you should, that is the best time to come, and preferably don't come during the third quarter and during the summer vacation here. That less likely. Experience in home country is only considered if NABH accredited? No. So it's, the question is NABH accredited hospital or any regular hospital. So experience is considered with any proper, like it does not have to be NABH, does not have to be JCI, does not have to be, does not even need an accreditation. It has to be a proper hospital which you can practice best your skills and knowledge. And having a worked in a JCI hospital gives you an advantage, because most of the hospitals here would be looking for JCI accreditation, or would be applying for JCI accreditation, or have to go through that process. So if you've already worked in a JCI hospital, you would be experienced in the inspections and things like that, and this would give you an added edge to, when compared to others. And this would help you, I would say, a preference, because you would be adding more value towards the quality aspect, or when it comes to JCI accreditation inspection process, your role will be therein as well, and you can market the role which you've already played in the country before, for which you've already worked and got, or working in the JCI accredited hospital. Apart from that, any hospital for which you could work would definitely help. It's just, whenever they do this verification process, make sure the HR or the person who is answering the call or responding to the emails in which they send the verification letter does it properly, which is very which is the most important thing. Apart from, does not matter which hospital or which pharmacy you're working at from the country. I think I have two more questions. Mohamed Gauss, I have completed Bachelor of Pharmacy, has got 2 years experience in pharmacovigilance. I'm currently pursuing PharmD. After my PharmD, do I have any opportunity to work over there? So as I've mentioned, your pharmacovigilance experience or any other experience apart from the hospital setting is not considered if you're planning to come here and work as a hospital pharmacist, as a pharmacist in the hospital or in the community. So you, because you've done your PharmD now after your bachelor's, in between you worked, either way that pharmacovigilance experience will not help to apply for the roles in pharmacist and specialty pharmacy. Second, your experience counts from when you've completed your qualification, and after qualification it needs 2 years, so it starts from there. So if you're currently pursuing your PharmD now, your experience starts after you completed your internship, and that's when you start counting 2 years. So that is excluding internship experience. And right after internship, if you got a job in a hospital settings, the 2 years starts from there. And the hospital setting experience or the community pharmacy experience is what is required for applying for the pharmacist job, and specifically for clinical pharmacist and specialized pharmacists, you will need a hospital, specifically a hospital pharmacy experience. So someone's asking, is there any fellowships in oncology? So if you're talking about fellowships in this country, no, there is no any fellowship in this country. And if you have a fellowship in oncology, that again, post oncology, you'll still need another 2 more years of experience to get specialized pharmacist experience, licensing, to be eligible for the specialized pharmacist licensing exam as per the new PQR which has been released. So fellowship plus 2 years of experience post fellowship would be making you more eligible for the specialized pharmacist in oncology licensing. And we don't have fellowships here. And the fellowships, I think there are fellowships in India in multiple places in critical care and oncology, which would be worth looking at if you're planning for a long-term career in oncology. In this region, we have internship programs in multiple hospitals, and these programs are specifically for pharmacy graduates from the country. And again, getting a person from outside the country, the process is very hectic, and the hospital does not go for that. So usually the internship program is restricted to people in this country, and people from outside the country, they may have possibilities of doing observerships. That is no way related to internship. That is completely just moving around and seeing what the people do and how they practice in the region in different hospitals. You have some of the hospitals in Abu Dhabi have PGY1 residency program. This is ASHP accredited PGY1 residency program, which is again more related to people who graduate from the colleges from the country, from UAE specifically. And I think three hospitals have this as of now. And one of the hospitals is the one I'm working, and in the hospital I work, we only have it for pharmacy graduates, and that too from colleges from here who are from the Emirati category, that is the locals or the nationals, UAE nationals. And for the other hospitals which have this PGY1 residency program, they have for expats who have graduated from pharmacy colleges from UAE. So these are the programs we have, but fellowship is not there. And we don't have a PGY2 program. Soon, hopefully by next year or so, we should be having a PGY2. That would be, again, people who completed PGY1 will only be qualifying for PGY2. I think one more question. Being a pharmacist, how many years will we have working visa in UAE, and is renewal process easy? So being a pharmacist in UAE, it depends upon which hospital you're working. Most of the visa is sponsored by the hospital, and if the visa is usually valid for 2 years, I'm talking about residential visa. So when people come here for job hunt, they come on visit visa. When they get a job, the company or the hospital or the pharmacy is the one who applies for resident visa under their sponsorship. And again, if you can be residents here if you have family here, close family, father, mother here, then residence visa is possible. But apart from that, the company is the one who sponsors. The validity of the visa is usually 2 years to 3 years, depending upon the company. If it's a government company, you will get it for 3 years. If it's a private, it's for 2 years. And the renewal process is also done by the company, and you just have to if again the same company has family allowances in your contract, then the whole family is also eligible for getting visa under the company sponsorship. So these are the visa requirements. You come in for a job hunt here with the visit visa, you switch to residential visa. If you have a job, the company sponsors you. The visa is valid for 2 to 3 years depending upon the company. And if in the contract you sign for if your family allowance is there in the contract, then the whole family is eligible for getting a residential visa, and it depends upon the contract. So good thing is, like, whatever the salary I've mentioned before, it includes some of them. The higher pay scale will include, say for example, it will include allowances as well. So the least I've told is 3,000. It does not mean that everyone gets 3,000. On average, everyone would most of the on average, every good hospital or every good pharmacy would pay something around 5,000, 6,000 to 7,000 on average. So this includes the allowances, flight tickets to and fro once in a year, and some of them offer family sponsorships, accommodation, and again professional development allowances as well, depending upon where you work. And again, these are the package, and basic salary will also be there, plus all these allowances added to the salary package. And I think this sums up how the salary is structured, and the visa requirements would be the company's responsibility to get a resident visa. Are there any other questions I can clarify? Because I think my slides were very few, just because I wanted to make it more interactive, and I hope a majority of what I've cleared on the slides are from what has been asked to me previously in uh, multiple other discussions, or through emails, or through social media. People ask me the same question, so I think that's been covered on the slides. And good that you've got the update of the new requirements. Apart from that, I think most of the questions been answered. If you still have anything to clarify, please go ahead and ask. I think this is the right time, and interacting and clarifying questions I would be really useful for you, and I would be helpful to do that as well. If you don't have any, then I think if you have any questions in future, you can ask me through the email, or you can message me in LinkedIn as well. I would be available. I think if there's no questions, I think I would give turns to the host. Thank you so much.
Thank you so much, sir, for your valuable time and for sharing your valuable insights with us. So if there are no more questions, we come to the end of today's webinar. I hope you all have taken back something and all your questions are answered. So thank you, everyone. Have a great day.
Thank you so much.